Hey everybody, welcome back to Riverwalk Talk. My name is Chip Harrington, just like it says right here. I started the show a while ago to talk about all sorts of different things, and it's one thing that I think we all, or many people have in common, is that we all have some kind of back pain. Whether it's your cervical, your neck, your lumbar. So many people suffer from back injuries and back pain. I did, I should say, as well. I was very active, played football growing up, been skydiving, wrestled as a kid, all sorts of things. So at mid-50s, I really started experiencing some back discomfort. And I kind of went through a little bit of a journey. Like about 15 years ago, I actually had, I think it was my 3 and 4 cervical discs fused together. And as a result of that put more pressure on up and below the cervical spine. So I suddenly started having more complications. And I went back to the doctors and said, hey, having these symptoms, what do I do next? And it was like, went to 2 different guys and they both recommended additional fusions. And I was thinking, oh my God, I'm gonna be fused from the top of my neck to the bottom of my neck. I'm gonna look like the Tin Man walking around. And then I kept on doing some research. I actually found an individual right in our backyard in Holyoke, Massachusetts, working at a Holyoke Medical Center that has a practice where he does really non-invasive spine surgeries for all sorts of people. And I figured it'd be kind of cool. I mean, how many times you get a chance to talk to a neurosurgeon? So I figured I got an opportunity to do that. So I'm gonna talk to Dr. Pennings from Holyoke Medical Center. How are you?
Hello.
Let me come around the corner over here. Nice to see you. It's been a little while. I saw you on May 7th when I had my surgery. And I saw you I saw your assistant Michael as a follow-up and briefly there. So I appreciate you coming on to talk about this. So is it Frederik or Frederik? How do you say your first name properly?
It's really Fritz, but with an S because I'm from Holland.
Okay.
It's a Fritz with an S and not with a Z like the Germans.
Okay, that's good to know.
That's it, Fritz.
So
call me Fritz.
We're gonna go with Dr. Pennings. I feel more comfortable doing that. So again, thanks for doing this. So this little show here, it's a podcast. We walk from where we're starting here down to the clock tower in Ludlow. It's about 1.1 miles. One thing we need to keep in mind is kind of walking slowly, because as you talk and walk, you actually get out of breath. I have found that out over time. So
definitely in this type of weather.
Oh yeah, it's true. We're out here. It's about 85 degrees right now, but very humid. So I gave a quick little introduction about my situation there, and I want to get more into the weeds on that. But how does an individual from the Netherlands end up in Holyoke, Massachusetts as a neurosurgeon?
Yeah, that's a good question. First of all, how do you become a neurosurgeon?
Yeah.
That's already a very, very long road. I'll give you some background.
Yeah.
Like you said, I'm originally from the Netherlands. And to become a neurosurgeon in the Netherlands, it's probably even more competitive than in the United States. We have about 16 million people in my home country. And there are only 2 spots, when I became a resident, there were only 2 spots in the whole country to get into neurosurgery. So it's very competitive. So I was 24 when I was an MD. Mm-hmm. And then I had to wait for 5 years.
Really?
Until I had a spot. You work as a neurosurgeon and they observe you.
Okay.
And then in the end, like after 2 years, if you're good enough, they say you are going to get a spot. Which also has advantages because you actually see who you're dealing with. Mm-hmm. You are being observed by your colleagues, by the nurses, and you need to have certain characteristics to be fitting into that world. And I find that a big contrast with the United States, where residency starts right out of medical school. Yeah. And it's mostly based on grades. Mm-hmm. Like how smart are you? Are you super smart? Okay, then you can get into neurosurgery. But it doesn't say anything about the person.
Bedside manner and compassion, empathy.
And it doesn't say anything about your surgical skills either. So I'm I think it's actually a good thing, but to wait 5 years is a long time, by the way. Let me tell you that.
Yeah. So you were 24 years old. You finished medical school at that point.
Yes.
So prior to that, what'd you do? Your undergrad and grad, and what was that process?
That's also a different system. In Holland, when you're 12 years old, you're being basically split up in 3 categories.
Okay.
The smartest, they going to the right side and they go for 6 years of education. So you're sitting with your peers that all have the same IQ basically. Mm-hmm. And you go from 12 to 18. And after that, you can decide already what are you going to do. You go immediately into medical school or engineering or law school, or you name it.
Wow.
So you're right. It saves you time in the end, because I've seen the American system too. My own children, they just finished 22, they're done with college, and then,
Yeah.
I mean, you still don't know what they're gonna do.
Yeah.
So it's a different system. So that's the system up there. So you go straight to medical school when you're 18, but then it's 6 years.
Okay.
Medical school is 6 years, 4 years of practical, and then, not practical, what is it? Theoretical, and then 2 years you work in hospitals.
Okay.
And then you're an MD,
Okay.
and then your specialty.
And then your specialty. So, but at 24, you said you spent that 5 years kind of getting tested in the
Yes.
neuroscience.
Yes.
When did you have to pick what lane you were going to stick? You could have been oncology. You could have done anything, right?
No. So in 24 years, I went straight to neurosurgery.
Okay.
I worked as a resident, but you were not in training.
Okay.
So you worked at the Department of Neurosurgery. I was actually operating too. Not everything by myself, but certain surgeries that you will do when you're a second year resident, for example, I would be doing already. And then finally you get the answer like, yeah, you're going in training, but you have to see, like I just told you, 2 spots in the whole country. There are many guys and girls that came through and wanted to be a neurosurgeon, but yeah, that's great.
Okay.
But no spot for you.
So
Move on.
What was the spark for you for neurosurgery?
That goes back to my childhood. I was 9 years old when my mother was diagnosed with a terrible neurological disease, and she needed to get a brain biopsy done.
Oh.
And she died eventually when I was 9.
Oh.
And then my father said to me, "You want to be a doctor, right?" I said, "Yes." He says, "You should become a brain surgeon," because he didn't call it a neurosurgeon. He called it, "You should be a brain surgeon." And as a little kid, I said to him, "Why?"
Yeah.
He says, "You can do beautiful things with your hands in a very unknown territory." He says, "It's the highest of the highest, and you can do a lot of great discoveries and research." So I said, "Okay, Dad,
Wow.
I'm going to be a neurosurgeon."
Wow. Okay.
Not know what I was signing up for, by the way.
But it's very personal, I'm sure, for you,
Very
because
personal.
something your mother suffered from and your
Yeah.
whole family was impacted by
Yeah.
it. So
Yeah.
that's
Yeah.
very interesting.
Yeah. So I tell you, we'll go a little further. I become a neurosurgeon, obviously. I go and I do my fellowship, my spine fellowship in UC Davis, California. And they asked me to stay up there, and I said, no, I'm going back to the Netherlands, because I already have a spot. Guess where I had a spot? Where I was going to work.
Yeah.
In the hospital, where my mom had a brain biopsy done. Because when I was little, on the wall there was this golden sign, and it had 4 names on it. Dr. So-and-so, neurosurgeon. Dr. So, and I thought, you know what? I like that.
Yeah.
Now, that sign wasn't there anymore. But I worked there for only 3 months, and then I went back to the United States, obviously. And at that point I said to my mom, I said, "Mom, I'm going back."
Right.
But it was nice to have worked here as a neurosurgeon for a little bit.
I'm sure that's a bit of closure, maybe.
Yes.
Or,
Yeah, that's good.
very
That's
nice.
good.
So you did your stuff in California, then you went back. Where'd you go next? You came back to America, you
I
said?
came back to America, and then we decided to settle here in Worcester, at UMass.
Okay.
That's where I became assistant professor. What was it, in 2008? And then immediately I started the minimally invasive surgeries up there. So I became the director of the minimally invasive spine program.
Okay.
That was my niche at that time.
Yeah.
And still is.
It's making more sense to me now. I mean, Worcester's only 60 miles away from Holyoke, I should say.
Yeah.
So what was the impetus to get yourself out here in Western Massachusetts?
Yeah, that's interesting too. There were some changes going on at UMass, and I decided, you know what, this is not my place anymore. And then I was either going to Boston, they asked me to go up there, Colorado and Florida.
Okay.
And then a friend of mine said to me, "You need to look at Mercy Hospital."
Okay.
I said, "Mercy Hospital? Where is Mercy Hospital?"
Yeah.
"In Springfield." I said, "Springfield?" I said, "No." He said, "Yes." He says, "Nobody does minimally invasive spine surgery up there." So I went there, and I met my future colleagues at that time at Mercy, and I was like, you know what? this actually sounds pretty interesting. So I went to Mercy Hospital, where I stayed for 5 years.
Okay.
Great time, great colleagues. And then COVID hit. And I was still operating. We just kept operating during COVID, but there were shortages of nurses. And I couldn't get the time that I needed to do my surgeries. So I looked around, I spoke to Cooley Dickinson, I spoke to Holyoke, and Holyoke said to me, why don't you come here? And I said, to Holyoke?
Right, right.
And they're like, yes. I said, I don't know. So eventually the end result is I did go, because they made me, a good offer, and they gave me the freedom to develop what I want further. And that's why I did it. And so far, so good for the, what is it now, 2 years, a little over 2 years.
It's only been a couple of years.
Yeah, 2 years.
It's so interesting. So at the top of the show, I was just talking about how, I had some issues, and that's how I got to know you. And I, went on the Google machine and was like, who does minimally invasive surgery around here? And Holyoke kept on popping up, and I'm like, it must be just some weird sponsor thing. It really can't be Holyoke Medical Center. So I went to Springfield, I tried Hartford, I tried Boston, I tried Worcester. I actually met with a doctor in Worcester, and he was the second guy, and he was like, yeah, we're gonna fuse you from here to there. And I was like, oh my God, I remember going home telling my wife about it. And she was like, God, because he was telling me, he's like, you may not be able to work ever again, this might be a whole thing. And I was like, holy crap. And then I had a friend who was just like, hey, at Holyoke Medical Center, there's this minimally invasive. So I picked up the phone. I spoke to somebody in your office. I think I had an appointment like 2 days later. It wasn't like, wait. Met with you 2 days later, and you're like, yeah, there's this cervical disc replacement that I'm like, well, what's my quality of life after? You're like, you can go play hockey if you want. You can do, pretty much whatever you want.
Yes.
And I was like, oh my goodness, like what? Why isn't this more we'll get into the weeds of what the actual surgery is there, but why isn't it more widely known or practiced?
Well, that's a good question. I've been doing cervical disc replacement since 2006, by the way.
Yeah.
So it's not a new technique, although it became more and more popular. And a lot is dependent on the insurance companies.
Okay.
They would not reimburse you for it. So people were not doing it. Now they are approving it, but it's still a monetary issue, to be honest, I think. So I think, and then you have surgeons that are just so embedded in their techniques they don't want to change.
Yeah.
And now you have some people need a fusion, some people need an artificial disc, and there are people, we're going into spine endoscopy now with endoscopies.
Yeah.
Small cameras, that's also a huge development, which also should be considered now in a patient.
Sure.
So,
yeah.
But for you, in particular, you already had a cervical fusion done.
Yeah.
And you were neurologically not in such a great shape, and you wanted to continue working. And you needed a 2-level, if I remember correctly, you needed a 2-level surgery done.
Correct.
So, if you look in the literature, it's very well established that a 2-level artificial disc reduces your risk of additional surgeries in the future dramatically compared to a fusion. Right. If you had 2 more fusions done in your neck, you would have come back for more surgeries most likely in the future, that the level below breaks down. So for you, it was just perfect, I think. And like you said, you had an active life, you wanted to continue working, so that's why I gave you that opportunity and say, hey, do this. I think this, in your case, is the best option.
Yeah, thank God. Seriously, thank God. And you were like right in my backyard. Here I am looking all over, New England for something, and you were right in my backyard. So just to explain a little bit, like what I was experiencing. So I had surgery a while ago. Everything was fine. At that time, I was having a lot of numbness in my left shoulder, my tricep. Couldn't sit. It would really hurt a lot. Had the fusion. Good for 15 years. And then suddenly I started getting tingling in my right fingers. I started having balance issues. That was a big one. Balance issues was a real big one. And I was like, I think I need something more. So those symptoms are a result of the disc between the 2 vertebrae hitting my spine or
the spinal cord.
Yeah. So can you kind of explain other symptoms you've seen when stuff like that happens?
Yeah. So there's indeed a difference between pressure on the spinal cord which in the medical term is cervical myelopathy if you develop symptoms, or pain from pressure on a nerve root. Then you have the radiating pain down your arm or numbness in your arm. In your case, you had pressure on the spinal cord. So these people, they don't really complain about pain, believe it or not. They don't have, sometimes they have some neck pain, but overall that's not the problem. The first problem is usually their hands. And they say, I can't use my hands. What do you mean? I drop things, I can't button my shirts, I don't know what's going on. How's your strength? No, that's pretty good, but I can't use those hands. And then they get the numbness and the balance problems like you're talking about. That's very characteristic. And when you get really advanced, you get spastic gait, so you walk like a robot. That's terrible. I mean, I think you even had some of that.
Well, right when I came out of surgery, we could talk about that in a minute, but yeah, when I came out of surgery, I had some issues. So that's primarily, so we're talking, we keep on saying cervical. This is your
this is the
vertebrae
neck.
1 through 7.
Yes, correct. So in your case, I remember you already had changes in your spinal cord. So in other words, your spinal cord was in trouble. It didn't have enough oxygen, or it already had permanent damage. And there was only one way to find out, that is to operate and see how much of the symptoms can be reversed. Now that's a big difference between spinal cord compression and a herniated disc that presses on a nerve. Usually when you relieve that herniated disc of the nerve, the pain down the arm is gone. I mean, that's a highly successful surgery. 99% chance that your pain is gone. But with spinal cord compression, you have no idea because I cannot repair the spinal cord. I can remove the pressure for you, and then that's it. Then we have to see what the outcome is going to be.
Right, and I mean, and like I said before too, I would say a vast majority of the population has some type of discomfort at some point in their life through their cervical, lumbar, their spine. And, you know, the spinal cord, believe me, I did so much research on this stuff when I was getting ready for these things. It's really just an extension of your brain, right? It's your brain that's going down and sending your signals to everywhere else. And, and if you don't address it, you know, I think you alluded to it, once a signal is shut off for a period of time from your brain to wherever, that's gone maybe possibly forever. It doesn't rebuild itself.
And it can be progressive, obviously, too. And you cannot really, you know, disabled. You can even become paralyzed. It is possible. If you wait long enough.
Right. And now how about the lumbar? Is this disc replacement an option for lumbar surgery?
Yes. It's also in the lumbar spine. And that's even more difficult to get approved by an insurance company. So I do that as well, and I usually reserve that for very young patients with pure disc problem. So there's not much arthritis going on. They're pure of a disc problem that needs to be addressed. And then I do an attempt to get it approved. But I always let the patient know, if it doesn't work out, I'm sorry, but there's not much that I can do.
And that's sad, right? You know what's best for the patient, for the long-term outcome, but yet a maybe algorithm or AI or something is making the decision in the end as to what financially the insurance company can deal with.
I only studied, 20 years? And then I'm an MD, I'm also a PhD, by the way. And then I'm talking to the patient, right? I see the patient, I examine the patient, I see the films of the patient. It's not my first surgical plan I may make on a patient. How long am I a neurosurgeon now? Since 2006, so, you know, almost 20 years. So I hope I know what I'm doing. And then you have these insurance companies. They just tell you, like, no, why not? Well, you didn't go to physical therapy, or the MRI doesn't say this or that. Well, they haven't seen the MRI, they haven't seen any x-rays, they haven't seen the patient. It's honestly, it's very disgusting. It's disgusting.
It's got to be so frustrating from your perspective, and you know,
and more from my secretary that sits there and trying to get approvals. Oh my goodness! I
mean, actually, the most frustrating is the patient, right?
It's so bad. It's so bad. And then they get sometimes mad at us, and we have to explain to them, like, it's not us. I already made that surgical indication. You know, I want to operate on you. We're doing everything we can, but we're stuck. We're stuck.
So you grew up in another country and you're working here now. You know, and they keep on talking about, you know, the American medical system. From an outsider's perspective, now that you're on the inside, you've seen both sides. How does America compare to other industrial nations?
Well, obviously you spend way too much on healthcare.
Yeah.
But it's not on doctors. That's not on nurses. If you look at the amount money spent on physicians and nurses over the years, let's say last 20 years, not much has changed.
Yeah.
It's all insurance companies. It's all healthcare administrators. Healthcare administrators, 800,000% increase of them. For what?
Yeah.
Who needs them?
Interesting.
Huh? So that's a big problem. And then, of course, you have the what you don't have that much in other countries is the malpractice problems.
Okay.
That's another issue.
Okay.
So I don't have the solution up here. Some people come up to me and say, "Oh, you're from Holland originally, from Europe, yeah. Oh, you have a single payer system, socialized medicine. That's good, right?" And I said, "What are you talking about? We don't have socialized medicine. We have no single payer system. We have all different insurance companies, but it's cheaper." And I think I just mentioned some reasons why it's cheaper. But still, they have the same problems up there, although not with these approvals. If you get surgery, the doctor decides that you're going to get the surgery, so that's one good thing.
Sure.
But otherwise, they have the same issues.
There are people I know that have gone to other countries for, certainly in the dentist world, in the dental world, they've flown to
Turkey.
Yeah, to get, it's actually cheaper for them to fly there, get the procedure done, and then to do it here in America.
Yeah, and you have a nice vacation with it.
Yeah, exactly. So it's just, certainly,
But it's frustrating how much money there's spent on healthcare, and not. It's just if we had the solution, you and I, and we could save all this money. We don't have a question anymore about Medicaid or Medicare. I think we can pay for healthcare 5 times for the whole population in this country. That's how much money we're spending. But,
Yeah, it's so interesting. And, we read in the papers how Bay State is having their financial issues, Mercy's having theirs, Hartford Hospital, all around, they're all having these issues, and it's all kind of, I guess, related to what you're referring to.
Yes, I believe, I'm not sure about this number, but I believe I pay the salaries of 8 administrators. That's how crazy it is.
Really?
I mean, that's how crazy it is.
So through your practice.
Because I'm working,
yeah,
they're eating off me for eight people.
Interesting. Wow. I don't know. Well, like I said, we're not
going to solve it.
Not going to solve the problem here. So
we're not going to solve it.
Getting back to more of the surgical technical side of things. So when I had mine done, it was anterior. You went through my neck. I have like a little small. You probably can't even see it anymore. It's been a little while. Small scar. Why is that the more preferred route than, say, posterior?
So anterior, you're using natural planes. So you're not really destroying anatomical structures to get down there. And people don't realize that your spine is actually in the middle, a little bit anterior. So if I push here now, I'm on my spine.
Yeah.
People are like, what? That's it? Yeah. If you go from the back, there are a lot of muscles you have to go through. So in the end, that's more painful, causes more post-operative morbidity, as we call that, huh? So this is just a much easier approach. Again, in your case, the compression was also from the front, from anteriorly, as we call it. So I'm of the opinion if there's a problem from the front, you should address it in the front as much as you can. Sometimes you can, but otherwise you just do it from the front.
Right.
If the problem is mostly in the back, posteriorly, of course you can go from the back, but most of the times you can get away from the front. And it's just a way easier approach. I mean, look at you were home the same day.
Same, so I arrived at the hospital, I think at 10 o'clock or so, sat out there, did a little bit, did the pre-op, all that stuff. In surgery, I was home by 3:30 in the afternoon. And honestly, here's some pain meds in case you need it. I literally took a Tylenol just because you told me I should take a Tylenol. I never took another Tylenol or anything else after that. I had zero pain whatsoever. It was actually remarkable. In fact, that was on a Wednesday. I drove to Maine on a Saturday. Not sure if I was supposed to drive or not, but I did. And then spent 2 weeks up there just recuperating. But even my daughter was like, "Oh my God, I totally forgot you even had surgery like last week." She couldn't recall it at all. So it was my recovery was just absolutely remarkable. Is that a pretty common result that you hear from?
Yeah, I think so. I mean, believe it or not, I had neck surgery myself.
Oh, okay.
Done. Also an artificial disc. And I was back to work also in 5 days.
Yeah.
But maybe we are just exceptions. I don't know.
Maybe.
I don't know.
We're just perfect specimens.
But you were allowed to drive.
I was?
Yeah.
Okay, good.
Oh, I
'Cause
tell the
did.
patient, as soon as you feel up to it and you can drive, go ahead.
Yeah.
If that's in 1 day, I don't know.
Yeah.
But otherwise, I don't give you much restrictions. I don't know. That's not.
Yeah,
that's
I felt
not
totally fine.
necessary.
And honestly, my mobility, I feel like I have not lost any range of motion up or down.
No.
I went back I was at your office maybe 3 weeks ago for the post-op with Michael Bennett, your
PA. Yeah,
your PA.
Yeah, I've been working for 15 years together, I believe.
Yeah,
So.
he was great. And did the x-rays, everything. He's like, everything looks great. And one thing you had mentioned too is that sometimes, because there's a foreign body in your body now, your body might try to fuse it together, but
Yes.
he saw no evidence of that. But is that pretty common where it might just fuse itself even though it's a disc replacement?
Yes, I mean common. There is a risk for that, and again, this is my opinion. You're asking because if you talk to 10 other surgeons, you get 10 different opinions.
Yeah.
But I do think if somebody has a lot of degeneration, arthritis in the spine already, so you're already forming bone by yourself.
Yeah.
I don't particularly find it a good idea to put an artificial disc in.
Mm-hmm.
For that reason, because your body is already trying to form bone.
Yeah.
So I put this really expensive device on you, and then you give yourself a fusion,
Becomes a fusion anyways, yeah.
right?
Yeah. But is somebody's lifestyle determine that? Like if somebody's a more active person, still exercising?
No, I don't think it has
Yeah.
anything to do with it, to be honest.
Yeah.
No.
It was honestly, I can't say enough. The experience, from my personal, everybody's different, but it was such a great experience. I was so excited to find you in my backyard to do that, considering the other, 2 other neurosurgeons I went to were like, we're going to fuse you up and down. Yeah, so it was good.
Lucky you.
Yeah, very lucky me, exactly. How big is your practice? How many people work there? How many surgeries have you done over in Holyoke? Do you know?
I can tell you, I've done 800 surgeries in 2 years. So, and then, we named it the Institute for Minimally Invasive Spine Surgery. And so far results, knock knock, have been really really good. We had 1 infection in 2 years, which is amazing.
Mm-hmm.
And I contribute that to the minimally invasive techniques that we're using. So we have 3 front desk people, my secretary, another 5, then 2 PAs, so Mike Bennett and Aaron Pitrat, and then myself as a surgeon. I would love to add another surgeon, but I'm always afraid. You never know
Yeah.
what you get in,
Yeah.
what you get.
How does that work? If you want to, how do you try somebody out? Do you bring them into the room?
You want to, right?
Yeah.
You want to try somebody out, but you can't.
Right.
So you have to hire him or her, and based on good faith, and say, well, I think this is going to be a
Right.
good partner.
Right. How often do you get back home to the Netherlands?
About 1 to twice a year. My second mother, I told you about my mother died, but fortunately I have a great mom since I was 12, and she's 87 now. So I visit her, or she still comes over to see us.
Yeah.
So, but I go about twice a year.
Yeah. I'm going to Ireland for the first time. Would you recommend that the Netherlands is a beautiful place to visit?
Very beautiful.
Yeah.
Yeah. It's only a 45 minutes flight from Ireland.
Oh, that's true. Yeah.
You go
right
up and you're down.
Right. Exactly.
And everybody wants to see Amsterdam, I'm sure. I was trained in Amsterdam. Now, I'm originally from Den Haag, The Hague, and believe it or not, there's a big.
Yeah.
We don't really like each other. Believe it or not, we're only 40 miles from each other. But so anyway, but Amsterdam is beautiful. The Hague is beautiful.
Yeah.
And if you like bicycling, of course, you can cycle through the whole country.
Yeah.
Just on a bicycle. You don't have to worry about cars. You have, like you have up here, all your paths go through the whole country. And
Right.
it's flat, no mountains, so that's good too. We have beautiful beaches.
Skiing.
No skiing, no mountains. Then
No
we have
mountains.
to go. We, meaning if I lived there, I would go to Austria or France or Italy
Okay.
to ski.
What was the reason? Why did you need cervical disc? Were you an athlete growing up? What did you do to kind of maybe?
I was an athlete, but I don't think it had anything to do with it.
No.
I was trying to save some money.
Okay.
So I was making a how do you call it? A fence in the back of my yard, and I was using the auger.
Okay.
And after a week, after the auger, I said, "Oh yeah, neck pain. I always have neck pain." But then I went to my arm, and the pain was excruciating. I couldn't sleep anymore. I was crying at night from pain, and then operating during the day.
Interesting. So a one time, like, well, obviously car accidents happen, obviously, things like that. So using an auger, digging a bunch of fence posts could really trigger a disc slip?
Yeah, well, in my case, I had a bone spur, and I think just due to the vibration, it irritated the nerve root, and it wouldn't calm down. Believe it or not, 95% of the cases, the symptoms go away within 6 weeks.
Okay.
But not with me.
Yeah. Oh, wow.
So yeah, that was an interesting experience. Also for patients, when patients come in now suffering from neck pain going into their arm, I'm very respectful.
Yeah.
I'm very,
Been there. How long ago was your surgery?
That's right before you. So more than 2 years ago.
Oh, okay.
Yeah,
So it's fairly recent.
Yeah.
Interesting.
Yeah.
And just one level?
One level. And the reason why I choose an artificial disc, by the way, is because my level above it is also not that great. So it's like, you know what, if I need a second level, I prefer to have a 2-level artificial disc.
So now that I've had a fusion and 2-level artificial discs, am I done? Could I ever get another artificial disc? I mean, I hope I never have to, but would that be an option?
Yes.
Okay.
If you break down somewhere else, you can add another artificial disc. Yeah.
Wow, it's remarkable. I saw well, you showed me the x-rays of other people, or the MRI I should say, and I watched videos on it, and how the disc is actually kind of placed in there and it's fitted. There's different sizes, obviously.
Yes,
you gotta. How long does a surgery like that take, typically?
Usually about an hour.
Per.
For in your case?
Well, just not mine, but just per disc. How long?
Yeah, usually an hour, and 2-level, usually an hour and a half.
Yeah.
But again, it varies where you. That's my time. You have surgeons that take much longer, or even probably shorter too.
Yeah, right.
So, but my average time is about 90 minutes.
Yeah. I think I was
for 2-level.
I remember when I saw you after post-op. You came over, and your exact words were, "Your neck was really shitty." That's actually what you said.
Sounds about me.
Yeah, and I was like, "What do you mean?" You're like, "Yeah, you were kind of all banged up in there." So, so hopefully it's all cleared up now.
Yeah, your spinal cord was not. That's why I think after surgery you had a little bit initially some trouble, because your spinal cord was already banged up. So.
Yeah. So what happened was, when I came out of anesthesia, my right leg was sort of convulsing, and I was like, "Oh man, this is crazy." And you're like, "Hey, get up and walk." And I was really kind of in that robo walk, like you were saying, like. And he had a nervous look in his face. So I was like, "Oh crap! If he's nervous, what should I be?" And then you're like, "We want to stay or want to go home?" Like, "I'm going to go home." And honestly, within 40 minutes, that had subsided.
Yeah.
And I was talking to your PA Mike, and I'm just like, it feels like my brain was trying to send signals to my leg for how long, and finally the path was open, so it sent all the signals all at once, and my leg was it didn't know how to handle it.
That's how I explained it to you afterwards too. It's just your spinal cord says, "Oh my goodness, I have space again.
Yeah.
Let me go wild a little bit," and I think that's what happened.
Yeah. So it all worked out. It did. So, well, thanks for coming out to Ludlow. I do appreciate it.
Yeah.
It was a little warm out here today, but if I'm going to have a link to his website down below if you want to check him out. If you're having any issues, I would highly recommend. The actual title of your business or your practice is the non-invasive spinal.
It's Institute for Minimally Invasive Spine Surgery. That's it. Yeah.
So check him out down there. It's always good to get. I had 3 opinions. He was my 3rd opinion, so I was kind of checking around. It's always good to go and kind of go, not shopping, but see what options are out there.
I agree with that too.
Yeah, perfect.
I would never be mad if you go somewhere else for another opinion. Some patients, actually, I had a patient last week. She says, "I didn't mention I had a second opinion too because I was afraid that it would tick you off." I said, "Why?"
Yeah.
Go ahead.
Yeah.
I want. And in the end, I want to know what the other surgeon said and compare it to my opinion.
Right.
And sometimes I say, "Hey, you know what? That's a great idea.
Yeah.
I didn't think about it."
Yeah.
I mean, that's just the way it works.
Right. That's how it worked out for me. So that's going to do it. Thanks for tuning in. We'll see you very soon.